the speed at which we achieve coverage of vaccines and vaccine equity is important. One, because the longer we see high numbers of cases of COVID-19, you're looking at particularly, healthcare systems in low resource areas become overwhelmed by cases, become overwhelmed by hospitalizations, and that's taking away from potential care for other endemic diseases. And so the secondary ripple is much larger. But beyond that, the impact on healthcare workers. We don't have a handle on how many healthcare workers have actually become infected or have died from COVID-19, but I can imagine that number is in many thousands, and that's taking a workforce away from many resource-limited countries that could be employed in providing care to all the other existing sort of medical conditions and challenges. When the cases of Ebola receded, we started seeing outbreaks of measles, because what you saw was childhood vaccination rates had gone down. You started seeing other health indicators get worse. And as we come out of this pandemic, the secondary impacts, on health indicators, on economic indicators, on childhood mortality, on women's empowerment, we have a lot of work ahead of us. In fact, there are studies, for example, IMF had a report that said in the 5 years leading after any major epidemic, you see income inequality get worse. And we know that it's not just the inequality that gets worse, but if we don't achieve vaccine equity, that has huge economic impacts for the whole global GDP. There's a RAND Europe report in December that talked about the fact that if we don't achieve that vaccine equity, the global GDP would lose about $1 trillion. And so it's people's lives, it's people's health, it's the economy. And so we can ensure vaccine equity in terms of numbers of vaccines, but to achieve true equity is to build resilience and stick around to help with the long tail in many of the countries that have been heavily affected.